Hello guys, welcome to Dr. Science. So today we are going to talk about the pathogenesis of rheumatoid arthritis. So rheumatoid arthritis is a type of autoimmune disease where there is destruction of your articular cartilage of the joint. Now the main culprit of the rheumatoid arthritis is a arthritogenic agent. Now this arthritogenic agent is mainly of two types. One is your microbial antigen. The other one is your self antigen. Now before going into the topic, I would like to talk about some of the basics here. So suppose this is the bone and here is the other bone, and these two bones are covered by a synovial membrane. This is your synovial membrane. Not only that, there is a cartilage present here which is guarding the bones, and this is your articular cartilage which is made up of hyaline. I hope you are clear with these terms. Now we are going to see what is going to happen in rheumatoid arthritis. So in rheumatoid arthritis there is arthritogenic agent. So here is a bacteria. On the surface of the bacteria there is antigen. This antigen is called as your microbial antigen. Or similarly, we have our cells. Suppose this is our cell. Our cells have antigen present on it. These are called as your self antigen. Now whenever there is a microbial antigen or a self antigen which will go and stimulate a CD4 positive T helper cell. So the arthritogenic agent will go and stimulate the CD4 positive T helper cell. Now we will try to draw the diagram of this CD4 positive T helper cell here. So this is the T helper cell which is CD4 positive. Now this T helper 1 cell, there are different types of T helper cells such as your T helper 1, T helper 17. Okay. CD4 positive T helper cells are mainly of two types, T helper 1 and T helper 17. So T helper 1 cell is stimulated by the arthritogenic agent. Whenever it is stimulated, it will produce substance such as your tumor necrotic factor and interleukin 1. So this tumor necrotic factor or interleukin 1 will go and stimulate the synovial cells. I already told you the synovial layer, as you can see here, this synovial layer is going to have cells on it. So the T helper 1 cell will produce tumor necrotic factor and interleukin 1 which will stimulate the synovial cells. Okay, that's why tumor necrotic factor antagonists are used in treatment of rheumatoid arthritis. So what will happen once synovial cells are stimulated? These synovial cells produce proteases and destroy the articular cartilage. Okay, so tumor necrotic factor and interleukin 1, especially the tumor necrotic factor, is very important here because it will stimulate the synovial cells and produce proteases which will destroy the articular cartilage. The second one that is produced by T helper 1 cell is rank ligand. Now what is meant by a rank ligand? Rank ligand is a substance which will go and stimulate the osteoclasts. Osteoclasts have long claws, as you can see here. These are your osteoclasts. Whenever rank ligand is produced, these osteoclasts have rank receptor, and eventually the rank ligand will come and stimulate these osteoclasts. Okay, once it is stimulated, these osteoclasts will destroy the bone, or in simple terms we can say there is bone resorption. I hope you are clear with this stuff. Now the next thing is, there are cells called as your T helper 17 cells. As you can see here, this is a T helper 17, which is also a CD4 positive cell. This is T helper 17. Now this T helper 17 is stimulated by the arthritogenic agent. Now whenever it is stimulated, it will produce a substance known as your interleukin 17. Now this interleukin 17, the function of interleukin 17 is to recruit the macrophages and neutrophils, but we will focus on macrophages. It's like recruiting the army. Okay, so T helper 17 will produce interleukin 17, which will recruit the macrophages. Once the recruitment of macrophages happens, I already told you there was T helper 1 cell, right? This T helper 1 cell will also produce a substance known as your interferon gamma. Now this interferon gamma will convert the normal macrophages, this is a normal macrophages, into super macrophages, or we can say macrophages are activated. So once again, T helper 17 is going to produce interleukin 17, which will do recruitment of macrophages at the site of injury. Once that is happening, the T helper 1 cells will produce a substance substance known as interferon gamma, which will convert the recruited normal macrophages into super activated macrophages, or we can simply say there's activated macrophages at the site of injury. I hope you are clear with this. Now we will do a small summary in order to understand this properly. So T helper 1 cells were producing rank ligand, which were activating the osteoclasts and were doing bone resorption. Not only that, T helper 1 were producing tumor necrotic factor and interleukin 1, which were stimulating the synovial cells on the synovium and secreting proteases, which were destroying the articular cartilage. Destruction of articular cartilage. Not only that, T helper 1 cells were producing interferon gamma. Now the special cells were the T helper 17, which were producing interleukin 17, which were recruiting macrophages at the site of injury. Now the interferon gamma will go and stimulate these macrophages and convert the normal macrophages into super macrophages or activated macrophages. I hope you are clear with this pathogenesis. So this is how the articular cartilage was getting destroyed by all these events. Okay, now we have to understand that, suppose this is the joint space and this is the synovial membrane, and here was the articular cartilage which was getting destroyed. So scientists were able to find here a cell. Let's draw this clearly. Scientists were able to find a cell here, and this cell was a type of plasma cell. As you already know from immunology that plasma cell will produce antibodies, right? Plasma cells will produce antibodies. So in the synovial or in the synovium, the scientists were able to find out that there were plasma cells and there were antibodies which were acting on antigen. Now what is this antibody antigen complex consisting of? Antigen antibody complex consisting of, the antigen here is citrulline peptides. Now what are these citrulline peptides? We have to understand by drawing a small diagram again. So citrulline peptides are nothing but whenever the arginine residues by post-translation mechanism, whenever the post-translation occur, the arginine is converted into citrulline peptides. Now example of such citrulline peptides include alpha enolase, vimentin, fibrinogen, and type 2 collagen. So all these are the examples of citrulline peptides. Hence they are used as markers of rheumatoid arthritis. Okay. Now finally we will talk about rheumatoid factor. Now this rheumatoid factor is present nearly in 80% of the population who are affected with the rheumatoid arthritis. Now what is meant by rheumatoid factor? In our cells, in our body, we have mainly IgM or IgA antibodies, and these IgM or IgA antibodies have Fc portion. Let's draw a different color here. So this is the Fc portion and this is the Fab portion. Okay. Not only that, our body also have antibody known as your IgG antibody. Now this IgG antibody is also going to have Fc portion and the Fab portion. So rheumatoid factor is nothing but IgM or IgA antibody against the Fc portion of IgG antibody. So as you can see here, this IgM, let's clear this IgM antibody is going to attack the Fc portion of the IgG antibody. So this is known as rheumatoid factor, which is found in the synovium. Okay. So what were the things that were in the synovium? So this is the joint space. It is going to have a synovial membrane, and here was the articular cartilage which was getting destroyed. So in the synovium we have plasma cells which were producing antibodies against the antigens such as your citrulline peptides. And not only that, we have T helper cells such as your T helper 1, T helper 17, which were destroying the articular cartilage. And not only that, in the synovium we have the most important one, which is your rheumatoid factor, which is IgM or IgA antibody against the Fc portion of IgG antibody. So that was about the pathogenesis of rheumatoid arthritis. Thank you guys.